Okay. Good evening, everybody. At least here in New York State, it's a beautiful Wednesday night here. And we're so thrilled to have you with us as we're joined by our friends from Fort Health here. We're seeing people joining our webinar here, so we'll give you a moment to get settled in, but we're going to start momentarily. Again, thank you for joining. If this is your first webinar with us and you're wondering where your video is, there is no video for these webinars. You are default unmuted, but default muted, excuse me. But there will be opportunities to chat with our presenters later in the webinar as people are coming in here. Let's get started. So welcome everybody. I'm Zach Pierce. I'm the Family Education Specialist at the School Mental Health Resource and Training Center, which is a program of Mahaney's, which is the acronym for the Mental Health Association in New York State. We provide family education webinars, and thank you for joining us. That's exactly where you are. As Susan said here in the chat, Susan is the Assistant Director of the School Mental Health Resource and Training Center. Please share where you're from in the chat, where you're joining from. I'm joining here from Schenectady, New York. And you guys can put it into the chat. As we do that, Long Island, all right. As we do that, I'll have Dylan and Shai introduce themselves and share where they're coming from tonight.
My name is Dylan Goodwin. I will be speaking on the topics discussed today. I'm currently based out of the city of Philadelphia. Thanks for having me.
My name is Shai. I'm one of the founders of Fort Health. I'll be supporting Dylan tonight. I am currently speaking to you from the Alps in France, where it is 1:30 in the morning. Happy to be here, and we'll be happy to have a discussion over chat and do some Q&A afterwards if time permits.
So we appreciate everybody joining from the Eastern time zone and beyond. So I will keep the chat open, and I encourage you to ask questions and discuss with each other during the webinar. You can also use the Q&A function on the bottom to send questions directly to our presenters. We will take questions toward the end of the presentation. So please put those in the chat, put them in the Q&A box. And as a reminder, this will be recorded and posted on our website and also likely on the Fort Health website. So without further ado, welcome, and thank you for joining us on this essential topic, especially as we are in the middle of election season in the United States, and anxiety is at an all-time high in this country, not just with the election, but with a deluge of bad news. And how do we support kids and families across New York State and beyond to not only cope, but to help build resilience? That's what Dylan and Shai are going to be talking with us today. So again, thank you for joining. If you have questions, put them in the chat. Gentlemen, I turn it over to you.
Wonderful. We'll share a screen here.
Great, thank you.
Okay, so a bit of context. As we speak right now, 1 out of 5 kids and adolescents are affected by anxiety and depression. These rates represent a 100% increase from the numbers recorded in 2019. So an increase in the rates of anxiety and depression among children and adolescents. And lastly, 90% of young people have been exposed to harmful or disturbing content in the last 12 months. So there is definitely an established, nearingly clear established link between being a consumer of harmful content, bad news, and anxiety and depression. In terms of us, who we are, so we're called Fort Health. We provide insurance-covered therapy and psychiatry in New York, New Jersey, and Pennsylvania. We treat parents as well as kids. We cover ages 4 to 24. We will have appointments typically within 7 days. And the unique thing with us is that we work not just with the families, but also with the pediatricians and the schools. Dylan, I'll let you introduce yourself for a sec.
Sure. My name is Dylan. I am an LCSW licensed in the state of New Jersey, but like I said, from and based out of Philadelphia. Um, Specializing in anxiety, ADHD, depression, oftentimes utilizing the modalities of CBT. I'm also a big fan of mindfulness and mindfulness-based stress reduction. I think, you might understand a lot of where I'm coming from in regards to, or a direction rather, of helping our youth and really helping just individuals learn how to use their body as a tool to help themselves regulate and cope. So that will definitely be a part of what we're talking about a little bit and how that can really be, incorporated into this concept.
Yeah. The format that we have today, hopefully to encourage questions from you, our audience members, is really in the form of questions. So we looked at common questions that people typically have about this topic and have prepared answers for them. So that's essentially what we'll be doing today. Q&A from us to us, and then hopefully from you to us. So with that, let's get started. Um, so Dylan, why is this topic so important to discuss, especially in the current climate?
Yeah, absolutely. Discussing news and its impact on mental health is crucial in today's fast-paced, information-rich world. Constant exposure to distressing news can lead to significant anxiety and emotional strain, particularly for our kids and our teens. By openly talking about news events and their effects, we can help individuals process their feelings a little more effectively, foster resilience a little more effectively, and help the youth of today develop healthier coping strategies to handle these kind of things. Engaging in these conversations also allows us to address misinformation, provide accurate context, and support mental well-being, ensuring that news consumption doesn't exacerbate stress, but rather contributes to informed and balanced perspectives. Easier said than done, especially with the constant, barrage, if you will, of sensationalism and, like we said, misinformation. Additionally, the invention of these things, you can't really see it on my screen, it's a phone, totally changes the way human beings process information. And if we are processing information in different ways, that means we are experiencing stress in different ways as well. So we're entering kind of new territory in terms of how we are processing news, consuming news, understanding news, and expressing it to one another. And that's kind of why it's important.
Excellent. Thank you. So what does the research tell us about how exposure to news impacts children and adolescents emotionally and psychologically?
Sure. So research indicates that exposure to news can have significant emotional and psychological effects on our kids and our teens, which can vary depending on the content and the individual's age and developmental stage. Um, some things that we want to look out for, emotional distress. So exposure to distressing news, such as violence, disasters, conflicts, can lead to increased anxiety, fear, sadness in children and teens, also anger, confusion. Studies have shown that repeated exposure to such content can exacerbate these feelings and prolong the duration of these symptoms. News about threats or disasters can create a heightened sense of vulnerability and fear. For instance, news about climate change, terrorism, or pandemics can lead to increased anxiety about personal safety and the overall viewpoints of the future. It can also encourage desensitization. So regular exposure to violent or negative news can lead to desensitization, where children and teens may become less sensitive to distressing events over time. Not a great concept. This can affect their emotional responses and empathy towards others. It also can create cognitive impacts, whereas young people may struggle to understand the complex news stories in which they are just being force-fed these days, which can lead to confusion, misrepresentation about the worldview they have. Again, all of this is based in perception, and perception plays a heavy role in how we regulate emotion and how our nervous system responds to stress. Behavioral changes are also something that research shows is impacted. In some cases, exposure to news can influence behavior, such as changes in social interactions or increased avoidance of certain activities. For instance, like going to school or engaging in activities that they once enjoyed. Something that's really interesting too is that research also suggests that the total avoidance from consuming news may not be the healthiest option either, which seems to be a big choice by a lot of individuals. And that is that 0 to 100 kind of, or 0-1 binary perspective that it seems that a lot of us fall victim to. So, as the research kind of says, parents are sometimes afraid to bring up intense news with their children and their teens because they don't want to scare them. But children will often hear about this news regardless, especially if it's getting a lot of attention in the media. And bringing it up can alleviate, if we kind of handle it with intention, it can alleviate anxiety that they might be feeling. Avoiding potentially scary and heavy topics can make them even scarier for children. you know so I offer that expression. I'm a big quote guy. So what's the saying? We must face our fears in order to overcome them. And this is that same concept in terms of developing healthy tolerance towards emotion and how to consume news.
Mhm. I think that last portion you mentioned is critical, right? As parents, our instinct is trying to protect our kids, and oftentimes, therefore, in this context, right, is to try to dismiss bad news, pretend it didn't happen, say it doesn't concern you, try and hide it from them. We cannot. There was actually a study that was done around COVID that showed that the control group had parents not help their kids avoid the news, and then the experiment group had them avoid it. And among the parents who try to get their kids to avoid the news, anxiety was actually increased because they weren't having those conversations. They weren't equipping their kids with skills. So yeah, I think your last piece is especially resonant. Just trying to protect them from it, and by having them avoid it, is not probably not the way to go here.
Yeah,
Um,
agreed.
moving on to the next question. Um, how do different age groups, so let's say children versus teens, typically respond to news about traumatic or harmful events?
Yeah. So children and teens respond differently to news about traumatic events, mostly due to their developmental stages. And this is going to be impacting their cognitive abilities to critically think and to just, comprehend information. Younger children, between the ages of like 3 and 12, oftentimes struggle with abstract concepts and interpret news more so literally, which can lead to fear, anxiety, behavioral changes such as clinginess, avoidance, nightmares, etc. They tend to seek reassurance from adults and may use play as a way to express the emotions that they're feeling from the information that they are exposed to. And in contrast, teens, around the ages of like 13 to 18 and older, have more abstract thinking abilities and can understand complex issues and their broader implications, which means that they can understand a little bit more. Their critical thinking is a little more far spread. It's a little more active in that regard. They too can also experience intense emotions from consumption of news and media coverage, intense ones rather, such as anxiety, anger. Again, these are what can affect worldviews and what it is to sit in vulnerable spaces, through micro perspectives and through macro perspectives. Teenagers oftentimes turn to peers and social media for support. And if we've studied or talked about social media at all, that might be a double-edged sword in terms of how we are understanding our information and where, we are grounding our sense of the world. So those are some key differences.
Okay, wonderful. So what practical steps can I take to help my child develop a healthy relationship with news?
Yeah, absolutely. Great question. I'm sorry, hold on. Steps. Okay, so one aspect that we want to, kind of really highlight is monitoring our news exposure, and trying to make it age appropriate when possible. So try to ensure that the news content that your children are exposed to is suitable for their age and developmental stage. As we kind of said before, teens can handle more critical thinking, children, not so much. Also, just in regards to how much screen time we're having and how much we're exposed to anything, we should really limit that exposure. Control the amount of news, your kids see, especially if it is causing distress. Balance news exposure with positive and age-appropriate content. Balance seems to be a really important factor in terms of healthy emotional regulation and certainly healthy behavior when it comes to consuming news. Other aspects that are really important to consider: provide context, simplify information, make it digestible for your audience, which are your kids. Break down news stories into simpler terms that your children can understand, again, depending on the age appropriateness. Avoid exposing them to too much graphic detail. Encouraging open communication can be extremely effective. Discuss feelings. Encourage your kids to talk about how this is making them feel, and also have them share their thoughts and feelings about what they're seeing in the news. Try to listen actively and validate their emotions when appropriate. Discussing news together can also be a super effective tactic. When you can watch and read news together and discuss it openly, it can change the way we curate an emotional space about what consuming this news means. Never underestimate how important the emotional space that we create when we are trying to nurture and help our children learn about how to navigate emotions. Also, these are opportunities to teach critical thinking, right? So evaluate where the sources are coming from. Teach your child to critically evaluate the news sources, and distinguish between reliable information and perhaps sensationalism and misinformation. I think it's like a really, really important, skill to have as a child, and really just any human being nowadays. And also help them understand bias and understand that news can have biases. It's important to seek multiple perspectives to get a more accurate picture of what's really going on. And then lastly, provide reassurance and support. Offer comfort. Reassure that your child that it's normal to feel upset or worried or have big emotions from the news. And you can provide a sense of normality when it comes to that we don't need to change the world around us in order for us to feel safe or for us to be able to regulate our emotions. And so those are really two different perspectives there that we have to balance within this whole ordeal of consuming news, right?
Mm-hmm. Excellent. Excellent. Next one. How should I approach conversations with my child about horrific events, whether it's terrorism, mass shootings, or natural disasters, without causing them further undue fear and anxiety? So how do I approach these conversations?
Yeah, another great question. And a lot of things are going to be tied back into what I've been saying, just because of how important it is. So again, you want to highlight the age appropriateness. You want to understand, is my child capable of talking about something this intense? If we need to be talking about it and we can't go around it, how can I make it so my child can comprehend and understand and digest what it is that I'm trying to relay, the information, without it being, again, sensationalism or fear in that way? And also like just understand your child's current awareness, right? Gauge what your child already knows or what have they heard about the events. I think a lot of these themes in which we're tying together here is that open dialogue is huge. Meeting your child where they are at, and really like that comes from having these conversations in and out of just intense news conversations. This is, creating that safe space for where your children feel comfortable coming to you when they are struggling with big emotions or critical thinking or big ideas, right? So that's a pretty important concept. Providing reassurance, that safe space, right? Safety, emphasis. Reassuring them that they are safe and that you are there to support them is really, really important. And if you look at anxiety, which seems to be one of like the major culprits or symptoms of sensationalism and media coverage and media consumption, anxiety at its root is the perception of threat. So in order to alleviate our anxiety, we must curate a sense of safety. And this is where I mentioned mindfulness at the beginning of this. I'm really big into mindfulness and mindful minutes-based stress reduction, because what it does is it helps train your body to be used as a tool to regulate from emotion. And that's so, so important. Um, you know, when we experience anxiety, a lot of times we will struggle with physical symptoms. Like we will have our heart rate will increase, our chest will become tighter. Sometimes we will have stomach problems, you know. So we want to address the emotion that is physically residing on our body. When we can teach our children how to regulate their anxiety and their emotions without needing to change the world in front of them, they tend to gain empowerment from that. They gain confidence in handling these situations. It was a way to regulate their emotion so that they can better really utilize their cognition to talk about and understand what the news is saying, or really to be able to use that cognition more effectively. So safety concepts, coping skills are huge, and this is, again, another conversation that you don't have to have, paired with news directly, but just talking about big emotions. What do we do when we have a big emotion? What is a coping skill, right? Like, how do we cope with anxiety without needing to change the world around us, without the news needing to tell us that it's okay, right? Because I don't know if it's going to. um, so that's a really important aspect. And also normalize feelings, right? Let them know that it's okay to feel upset or scared from big and scary news, right? We don't have to pretend that it's okay. And we don't have to pretend that it's, going to be the end of our world. I think, again, finding that balance of, normality of feelings is really, really important towards helping your children find empowerment towards exploring vulnerability. A really, really important concept.
Excellent. Next one. How can I differentiate between normal curiosity about current events and maybe anxiety-driven behavior in my child?
Yeah, good question again. Depending on the child, it might not be as so easily to recognize differences between normal curiosity and anxiety. Sometimes fine lines, as they say, right? But mostly signs of normal curiosity are going to pertain questioning, if your child asks specific questions about what happened or seeking information to understand the event better, without expressing fear so much as curiosity, right? So distinguishing between those two. Um, Also an interest in details, right? So if they show interest in learning more about the event, again, being more objective, if they're showing more objective curiosity rather than the fear-based concepts, then that is going to signal more of that normal curiosity. If you notice that your children are balancing their engagements, so if they're interested in current events, but they're also able to maintain balanced approaches, showing curiosity without being overly fixated, I think is one of the major, indicators of the differences between anxiety-driven behavior and normal curiosity.
Uh,
Yes.
Sorry, help me understand a bit more about fixation. How do you define fixation, and what are some signs that indicate that we may be witnessing it?
Yeah, absolutely. So if you're seeing persistent behavior, persistent worry, repetitive concerns, right? So if your children are repeatedly expressing fears or worries about the event, even after receiving reassurance,
Mhm.
this is one of the major indicators of persistent anxiety. Fixation and rumination of thoughts is one of the major indicators of, anxiety and anxiety-driven behavior. If we're starting to see that our children cannot stop themselves from worrying or from switching the topics that they're thinking about, then that is a big, indicator in fixation and rumination in that way. Um, in certain behavioral changes, you'll see avoidance, right? So certain children may avoid certain activities or situations related to the event. Um, you know, Unfortunately, school shootings have been more of a common and modern part of our news lately. And having experience working in schools, something that was very common with the kids is that they were afraid to come into school. And so right there, is it valid? Is it acute stress? Yeah, it is, for the most part.
Mhm.
So what do we do? Do we stop going to school? I don't know if that's the right answer, right? And so that's where these emotional spaces and this open dialogue is so important in terms of creating, again, just more safety behaviors, and helping create that, regulated space, and more, I guess, more of an objective, and reality,
Mhm.
a realistic kind of perspective.
Wonderful. Next one. Are there any behavioral changes that might indicate my child is struggling with perhaps news-related stress?
Yeah, absolutely. And so I mentioned a little bit before in the last slide, you're going to see ruminating thoughts. You are going to see perhaps social isolation, avoidance of certain behaviors and certain activities that they perhaps once really enjoyed. Another really common behavioral change is changes in sleep patterns. So difficulty falling asleep, increased nightmares, sleep disruptions. In younger children, uh, individuals who are exposed to an influx of anxiety and news-related stress may revert to earlier developmental stages, such as bedwetting or increased clinginess, or perhaps increased separation anxiety. You'll also see an increased dependence of their caregivers and for their caregivers for the younger children. You could also see emotional outbursts, an increase in irritability, increase in large, outward emotions, crying, anger, aspects like that. You might also notice behavioral aspects in academic and social decline. So you might see that the school performance is starting to suffer, or perhaps they're not hanging out with their friends like they used to. Um, you know, our our emotions have a really, really heavy influence over our behaviors and our thoughts. And they can really, really change the way that we interact with the world. Again, why this topic is kind of important to talk about. You know? I guess lastly, and a more overarching theme that you're really going to see is increased hypervigilance, right?
Say more about that.
So yeah, hypervigilance is, that state of fight or flight. We're going to be in more of a protective state when we are in stress states. And when we are stressed, what that means is that we're producing the stress hormone in an irregular pattern. That is our fight, that comes from our fight or flight response center, right? Our children are going to feel more unsafe. And so, in that direct way, hyperactivity and hypervigilance, rather, is more or less the behavioral output that a lot of these children that suffer from anxiety often demonstrate.
Hmm. Okay. Next one. How can I encourage my child to ask questions about the news while managing their anxiety?
Yeah, another great question, right? And again, I always tell the families I'm working with that this is more or less an art form. You have to make sure that it fits for your family, right? And unfortunately, I cannot give you a one size fits all. However, the overarching umbrella themes can help you get there and create pathways to just more effective communication while their children can gain greater independence of emotional regulation. So never underestimate how important creating the safe space in your household is. When we can create a safe space for ourselves and for our family, we learn how to handle vulnerability and big emotions with greater effectiveness. Safety is a major theme when it comes to emotional regulation and what it is to be able to regulate from big emotion. So if you guys have, been paying attention for the last few minutes, I talk a lot about safety. Everything's safety, right? It is so important. And you might be wondering, well, okay, like my child is safe, right? But anxiety, again, is a perception of threat. And a really interesting fact about our brain is that the brain does not know if the event is or is not happening. It's just operating based off perception. So if we are constantly intaking lots and lots of stressful information, stressful news, right, that starts to warp our perspective. And that absolutely changes the way that we internalize the world and externalize it. But anyway, going back to the original question, creating a safe space for discussion is huge. Foster an environment where your child feels comfortable bringing up news topics and asking questions. Let them know it's okay to discuss their thoughts and their feelings. And also, additionally, emphasize that you are available to talk about anything they hear or see and that their feelings are valid and important. Also, encouraging curiosity within the household, and especially when it comes to exploring critical thinking and news concepts. Um, Instead of just telling your child what it is and what the deal is, ask them questions. Ask them open-ended questions. Prompt your child with open-ended questions to encourage them to express their thoughts and to ask their own questions. It's a great way to get them to practice critical thinking. And again, it gives them greater autonomy over understanding what's going on. I would also think it's really, really important to limit exposure and overall screen time. Screen time, not great for us, not great for the brain, not great for our capacity to regulate emotion. And unfortunately, every single person that I know has one of these screens with them at all times. And I don't really think that technology is going anywhere. So it's not, again, it's not about avoiding the technology at all costs. It is about teaching our children and really ourselves to utilize these tools effectively and safely. And also, again, as adults, and really like putting it back on you guys, how do you consume media? And what kind of behavior around media consumption are you mirroring within your household and within the communication and relationships you have with your children? That will tell you a lot about how they learn to interpret and react or feel about news.
Yeah, I think the last point is especially pertinent. Modeling is the number one way in which children learn from us, right? It's a classic do as I do, not as I say. One of our psychiatrists tells an anecdote from a session in which they discussed with the child their media habits, and the kid said, "Hey, my parents keep telling me to put down the phone." And I tell them, well, why don't you put yours down first, number one? And number two, you've been putting that thing in my face since I was 2 or 3 years old. How do you expect me to behave? Right? So it is absolutely, we're constantly on these things. We cannot expect our kids not to be.
Yeah. Well said.
Next question. What should I do if my child becomes fixated on a particular event or news story?
Um, so if your child becomes fixated on a particular event or news story, it's important to address their concerns while helping them manage their focus and emotions. Acknowledge their concerns, try to listen actively with an open ear, allow your child to express. Again, these are moments in which your children can really grow, right? We don't, as the saying goes, we don't grow in our comfort zones. And so these are hard things to talk about. These are hard concepts to talk about. This is where both you as a parent and your child grow as individuals and as really like a tandem in terms of that emotional growth aspect. Validate their emotions, right? Guide them. Do not, you know, take them all the way to their destination, help them get there on their own, if you will. Um, Setting boundaries is really, really important as well in terms of helping them, right? Redirecting focus, so helping them find balance, engaging in other activities. Also, again, if you have an understanding of how you cope through anxiety from media consumption, you can help teach them similar ways and similar strategies and coping skills in order for them to regulate through moments of vulnerability and big emotions such as anxiety and whatnot. Continue to explain the context, open conversations. If you feel like you are unable to, redirect their anxiety or redirect, big emotions that they have, seeking professional help is always a great option. And again, model healthy coping strategies. Really, really important. Cannot stress that enough either.
Mhm. Can you actually elaborate on, let's say, two effective coping strategies you advise families that you work with?
Yes, 100%. Okay, so as I mentioned before, I'm big into mindfulness. Big, big, big. It is great. In fact, I think it's like a foundation for our healing as in regards to how do we help ourselves? How do we heal? How do we rehabilitate from big emotions? That is a way that we can get our emotional regulation, our nervous system back to a healthy baseline. And so what mindfulness is, a lot of people, it's like a hot topic these days, right? Mindfulness is awareness. Well, okay, not quite. Mindfulness is more of a specific engagement. Mindfulness is to be in the present moment with our five senses without judgment. In fact, that definition is the exact opposite of what perception is. That's sensation. This is feeling the world around us as opposed to understanding the world around us. And why that is impactful is because you are using your body as a way to scan for safety, as opposed to your perception telling us what our safety is, right? And so if we can learn and train our body to objectively ground ourselves in the present time and space, your nervous system will send signals back to your brain to let you know that, oh, we're actually safe. Because for the most part, we are in houses, we are not facing extreme, life-threatening situations most of the time. So in order to train our body to really give a more of an objective sense of what actually is happening, as opposed to the perceptions of what news wants us to think or social media is creating, right? This is going to allow us to just gain more empowerment and gain a greater ability to utilize our body as a tool to regulate. Okay, so anyway, that's mindfulness. But then, okay, how do we use mindfulness? What are some coping skills that are mindful? Deep breathing is an amazing one. Actually, studies have now clinically proven that deep breathing actually can alleviate physical pain within the body. It's an extremely effective practice, and it's a coping skill that you have access to at any time of your life because you'll always have your breath with you. You don't need to charge your headphones. You don't need to charge your phone. You don't need to go to a class. You don't need to wait on anyone to talk to them, right? This is a skill that you can have always, and it's always accessible. So using your breath work and deep breathing, deep belly breathing, super effective to regulate our emotions. Another one is sensational grounding. So one of the really popular coping skills that I use with kids is called 5-4-3-2-1 grounding technique. And so what you're doing in this practice is you are going down your five senses and you are just one by one taking your time, grounding yourself to your time and space. So it kind of goes like this. What are five things that we can see right now? So if I'm going to practice this, I can see my laptop, I can see my phone, I can see my coffee mug, I can see my stereo speaker, and I can see my snake plant. And so then you just go down the line of senses, right? Next would be for things that you can touch and feel. Okay, I can feel my socks on my feet. I can feel my feet inside my shoes, right? And so this is a way to help our children and individuals, a person of any age can utilize these skills to ground ourselves. This has been shown to help relax and alleviate the stress hormone that is being produced when we are in distress moments, such as anxiety. So 5-4-3-2-1 grounding technique and deep breathing. I like box breathing or 4-7-8 breathing. Excellent. These are skills that if we can teach and start to normalize in our children's routine, they will start to operate and accept these really healthy, emotional, adaptive coping skills, similar to what we have created brushing our teeth to be, right? I don't know any kid who is passionate, or an adult for this matter, maybe a dentist, who is passionate about brushing their teeth, really. But that's not why we do it, right? We do it because it's going to create continued stability for our livelihood, right? Mindfulness, I believe, should be within that pantheon of maintenance in order to help us regulate our emotions more effectively. And so it's not really just a one-time thing either. This is something that I would encourage we do on a daily basis, right? The more that we can do these exercises on a day-to-day routine, the greater the skill will become, right? It's almost like the same concept. You don't go to the gym for one day and then you come out looking like Arnold Schwarzenegger, right? That just doesn't make sense. That's not how our body adapts to things. So when we can, encourage these healthy coping skills, we are giving our children a much greater chance at being able to, regulate and handle and tolerate these emotions, quite frankly. It's almost like a workout for your brain and your nervous system.
Mhm. And just on the points of mindfulness, so at Fort Health, all of our therapists, even though they come licensed and trained highly qualified, we provide additional training and support. And one of the things that we do is we align everyone on using the same CBT protocol, cognitive behavioral therapy protocol. And the one that we have chosen is called the Unified Protocol. Was developed in Boston University. And one of the innovations of that is the combination of mindfulness techniques with CBT. And that is one of the most heavily researched and most effective CBT protocols out there. So tremendous amount of research and support for using mindfulness, which up until a few years ago was considered maybe a little bit of a, I don't know, a fringe, but definitely not within mainstream of medical practice. It is absolutely becoming that now.
Yeah.
Um,
Uh,
the next one, how can I set boundaries around news consumption without making my child feel uninformed or perhaps left out? And I would say it's news consumption, broadly speaking, right? A lot of the news they'll consume out of social media.
yeah. Right. Again, um, such a hard thing to directly answer, but umbrella terms, right? Creating these spaces to openly communicate, explaining why in certain situations. These are the moments where we can start to harbor critical thinking, right? And we can start to really nurture more of these advanced critical thinking, techniques. Um, and also like involve them in the process, right? I think that's an important aspect. Can we de-intensify our response and an understanding to something rather intense? Like, for instance, the political, atmosphere right now. I think we can. Yeah, absolutely. I think there's ways to de-intensify what is happening as a way to just articulate more, how does the government work? How do politics work? How has this changed from since when I was, a child, your age, consuming media? Um, you know, keeping it open, and also offering alternatives for staying informed, right? So providing alternative, um, news sources like educational programs, perhaps books or journal articles, stuff like that. And also sensationalism in the news we consume a lot these days doesn't always talk about a solution. If you've noticed, it's really just about, oh, this is horrible and this is happening. Great. Um, well, you know what? It's important that we talk about the solutions. And it's also important that we focus on those solutions. Highlight news that focuses on positive outcomes, community efforts, or solutions to the problems that we are stressing about, right? And this can be more so providing dialectical perspectives, right? And so, just as a review, dialectics, two or more things that can live in harmony, but also oppose one another, right? So, really intense news, but at the same time, can there be positive outcomes from this really tragic news source? Perhaps like the community coming together. Does that inspire hope? Does that inspire empowerment? Okay, great. Wow. So now this conversation has turned from debilitating, to now uplifting and empowering. We can curate those directions for our children to take in the critical thinking sphere, right?
Mhm. Mhm. Next one, what are some age-appropriate ways to explain complex or distressing news topics to kids?
Yeah. So let's say another hard one. I'd say all these questions are kind of intricate, to be honest. So actually, I was really excited when I was asked to talk on this topic, which I think is super interesting and a little nuanced and, not a direct way. When it comes to like younger children, 3 to 5, keep it really simple, right? Use simple language, try to avoid graphic detail, focus on basic concepts that they can understand. Um, for example, if discussing a natural disaster, you might say sometimes there are big storms that can make things really intense and really messy. People are working hard to help the situation, right? And you can also use reassuring language, emphasize safety, big, big concept like we've been talking about, and what is being done to protect people. You can also use comforting activities. So engage in familiar activities such as reading books, playing, make sure we're tying a bow on it, right? As a way to alleviate and find balance within these like stressful conversations. Closure is an important thing, right? That I feel like it's hard to teach. You know, I know when I was growing up, certainly wasn't a thing that was taught too often. But how do we create closure in these things? Well, I think it's the concept of acceptance and moving on. What is it to accept something, right? Or find a solution? What if we don't have a solution, right? That's just expressing emotion, or maybe saying like, this is how it is right now, or yeah, it's hard right now, and we're gonna, keep working through it. But there's also other aspects of life that we can focus on, like for instance, I don't know, for me, the Phillies, for sure, right? Or something else that your kid loves. Not everyone finds a lot of joy from the Phillies or Philadelphia sports, but like finding things that are going to find a balance with our, lives. Remembering that we are intricate creatures and that we have so many different hobbies and so many different parts of our lives. Sensationalism is one aspect, in the news that we consume this. For, early elementary school kids, ages 6 to 8, rather, or like 9 to 12 too, in late elementary, we can start to provide more detail. We can start asking more questions. Again, I think the concept of meeting your child where they're at is super, super important. And again, you will know that best. Not every 11-year-old speaks the same as every other 11-year-old. However, again, everyone has context, and for the most part, they're going to understand what an 11-year-old can understand if we're using them as an example, right? Discussing feelings. Discussing feelings is important. And openly, right? Like, what kind of feelings are we experiencing when we are reading about this news or when we're hearing about this? There's a really great opportunities for us to have these conversations and for us to start teaching in those moments of vulnerability. Very big. Something I really see a lot of is that parents will try their best to avoid that vulnerability because we want to protect our children at all cost, right? And it kind of goes back to the original point of that avoiding news in general is also not good, right? So we don't want to be afraid of that vulnerable space. We don't want to be afraid of their emotions. That is where, if we can provide, that de-intensified response, that confident, empowered, but also welcoming and validating kind of response, we start to teach our children, oh, it's okay to be in vulnerability. That space is where we can create empowered and resilient youth and empowered and resilient adults as well. So as they get older, start to, encourage critical thinking, start to ask more complex questions, support their critical analyses, right? I would say those are pretty important. You can also use visual aids sometimes for younger children. Pictures, drawings, different ways to express. For older children, teenagers, a lot of them like to get into activism, right? So how do they get involved? That's another great way. How do they get involved in safe ways? That's another really important aspect that you guys can talk about. I think it's necessary to talk about.
Okay. Got more here. So, what coping strategies can I teach my child to help them manage anxiety triggered by current events?
I'm so glad you asked this. Guess what I'm going to say? That's right. Mindfulness, deep breathing, using our body as a tool to cope. Super, super huge. So teaching them these exercises, it might be important for you to know what mindfulness is and what a coping skill is and how do you cope, right? Mirroring that important, and calm down behavior protocols. Progressive muscle relaxation is another great tactic to use, guiding them through tensing and then relaxing different muscle groups to help reduce physical tension and anxiety. Have them establish routines. Routines create stability, big time. So if we are taking care of ourselves, if we're getting good sleep, if we're drinking enough water, right, that really provides such a greater level of stability for us to handle just greater amounts of stress throughout the day. I use the quote, "I'm at the end of my rope," often to express this idea. If we are not taking care of the core foundations of our wellness, we're going to be living perpetually at the end of our rope. And thus we can't really handle anything, right? But when we are taking care of ourselves in regards to I'm getting good sleep, I'm not on my phone for 12 hours a day, I am drinking a good amount of water, I am getting a good amount of steps in, I'm exercising, I am doing breath work, I'm doing all these things. Okay, you've just expanded your rope significantly. You can handle so much more. That's a really important concept to be able to share and to be able to really have your children take hold of as a habit, something that they can rely on. What else? Also part of routines is timing and schedules, right? We get sucked into these phones and they are made to be like that, essentially. If we can, establish and encourage greater, scheduling and restrictions in an autonomous way, again, they start to build that empowerment and confidence that, hey, I don't need to be stuck. I'm not dependent on anything in this sense. So that's something that can also be very effective.
Wonderful. Thank you. Um, I think we got a couple more. So, when should I consider seeking professional help for my child's anxiety related to current events or potential anxiety in general? When does
Yeah.
it become a cause to worry?
Yeah, great question. I think when you start to see that it is no longer within the normal limits of how someone operates with fear or anxiety. And so what that really means is how long and how intense is the anxiety lasting, right? If you're seeing that your child's anxiety about current events is persistent and overwhelming, and it's interfering with their daily lives or ability to concentrate, probably a good time, right? If they are expressing excessive fear and safety about the event, and they are disproportionate to the actual risk, that's another time to really contact a therapist. Um, Significant behavioral changes. So if your child becomes increasingly withdrawn, avoiding activities that they once enjoyed, or isolating themselves from family and friends, that's a pretty big indicator. Regressive behaviors, right? So like we mentioned before, bedwetting, clinginess, separation anxiety, or behaviors that are out of character for their age. Physical symptoms, somatic complaints, persistent kind of struggles with headaches, stomach aches, that don't necessarily have clear medical causes could be linked to anxiety. So a lot of referrals we get actually are from gastroenterologists. Um, you know, my child has IBS, my child is having intense stomach pain, is having, you name it. And we went to the doctors, they said we couldn't find anything. Anxiety is a huge culprit, right? So when you're starting to see somatic changes that are persistent, that is definitely an indicator to go seek some extra help. Um,
Yeah.
yeah, and so overall, just like a lack of coping. Right? They are struggling to get over the anxiety, and it's persisting. Its intensity and duration has increased.
Yeah, I think the somatic factors, right? So anxiety shows up in the body, right? It's one of those mental health disorders that really manifests themselves through feelings you have in the body. And that's also, by the way, a key in the treatment of anxiety. This is one of the reasons why the number one source of referrals for us at Fort Health are pediatricians, right? They are where 75% of behavioral healthcare begins, right? So 3 out of 4 families will go their pediatrician first when there's a behavioral health challenge. And the pediatrician will look at the child's health holistically and basically, well, very quickly, if that's the case, we'll say, okay, you know, physically, there's nothing wrong with your child's stomach. This is probably a mental health concern, and then they send the kiddos to us, and then it's the other thing that we do that's perhaps unique in the space is that it's not a one-way street. We communicate back to the pediatrician as we progress with the treatment. So whoever you choose, if your child does seek care, whoever you choose, make sure that the treatment that the child receives is holistic, coordinated with the child's pediatrician who has known them for years and years and years. Um, there is no health without mental health. This is what a lot of providers love to say. But we also believe that mental health linked to physical health is extremely, extremely important. Um, where should I turn for professional help? So I guess I was preempting that. Number one, talk to your pediatrician. Even if you don't think that they are the ones that can provide the care, they will know the providers to send you to. Second place to turn to is from your school. Talk to your school counselor. Talk to student support services. Um, Insurance companies. If you have employer-based insurance, there are insurance panels or providers on the insurance panels. Try those. Every state and state of New York as well will have an officer of mental health, like the good folks who are with us today. They have lists of resources. I think Zach and Susan can share those, if not in the chat, then later on in an email. Lists of resources of providers that they trust and resources within the state. And then finally, if you choose providers like Fort Health, We are not the only ones. There's a few of us out there trying to do good work. Visit the websites, do your research, look at feedback. And most providers like us will offer you a 15-minute consultation. Take that chance. Do not start care without understanding if this provider can provide your child with the care that they need. So take the appointment, do the 15-minute free consultation, have the conversation with the provider, and see if they can help you and make sure that you're comfortable with the help that they provide. Dylan, anything to add on those sort of quick list of tips?
I think you did a great job. Yeah, I would say that trust your pediatricians for cost-effective measures. Go through your insurance. Start talking about it more. One of the most, stigmatized things in our life right now is therapy and, trying to access care for our children. The more that we can talk about these things, like what we did today, the more information and the less stigmas there are around these things, the more empowered all of us can become to helping ourselves and helping our children.
Yes, excellent. So, um, yeah, if there are no audience questions, thank you all very, very much for coming today. Um, Thank you for taking time of your evening. Good luck, everyone, in the new school year. Again, we're called Fort Health. It's www.forthealth.com for residents of New York, New Jersey, and Pennsylvania. And yeah, thank you very much to the Office of Mental Health in New York State for inviting us today. And we will see you all next time.
Awesome.
Thanks,
Thank you.
everybody. I see Susan put the link to our survey here. Please take that. It helps us here at Mahaney's. And thank you, everyone, for your immediate feedback here. That's great. And we're so appreciative of Dylan and Shai for joining us. I linked to Dylan's page at forthealth.com. Also, our website at Mahaney's, specifically at the School Mental Health Resource and Training Center. That's mentalhealthed.nys.org, and as well as the great resources at forthealth.com. Both Susan and I shared a PDF of additional resources that will be available when this video posts on our website, so stay tuned for that. One question I did see in the chat very quickly here, I know that Naomi asked this, it was about modeling the 5-4-3-2-1 grounding practice. So Dylan, if you wouldn't mind just touching on that for a moment.
Sure, absolutely. This is a great practice. I actually do it in my own life routinely. I try to practice what I preach. So very simple, very easy. Remembering the three core components of mindfulness: present moment, five senses, without judgment. The without judgment part's important, right? So I'll mirror kind of both real quick. Let's say I am looking at my stress ball, right? It's a donut. Non-judgment would be saying, I can see my stress ball, my stress donut. Judgmental awareness would be, this is my stress donut that I got in 2018. That was a great day. It really brought me back to a great time in my life. However, I got in a fight with Susan back then. And you know what? Quite frank, so going down that narrative path, judgment, stay out of that. We're keeping it simple. We're keeping it straightforward, grounding, staying objective, stick to the facts. So real quick, I'll try to mirror this. 5 things that I can see right now. I can see my phone. I can see the donut stress ball. I can see my mug. I can see a pair of headphones. I can see my laptop. And I can see my monitors. 4 things that I can touch and feel. I can touch and feel my phone right now. I can, without using my hands, I can feel the shirt that I'm wearing resting on my shoulders. I can feel my feet touching the floor. I can feel my lower back resting against the back of my chair. And I can feel my keyboard on my laptop right now. Okay, 3 things I can hear. It's very quiet here. I can hear a car driving outside my apartment. Whenever you can't sense anything, we can always create our own stimuli as well. So, okay, I can hear my snapping. And if I continue to talk through this, I can hear myself talk in my own voice. All right, great. 3 things. 2 things that we can smell, okay? As we go down the list, it gets increasingly harder. So 2 things that we can smell. If you have food around you, go for it, right? I have my leftover coffee. All right, I can smell my leftover coffee. Remember not to judge it. What else can we smell? Here is a trick that I like to do. Again, if you're doing this in public, you might get some weird looks, but again, we're doing this to regulate ourselves. Smelling your collar usually will give you distinctive smell, right? Again, we're not judging it. We are just grounding ourselves to a different sensation. Lastly, one thing that we can taste. If you can't sense anything at all here because we don't have access to a liquid or a food, that's okay. But if you do, like my coffee, go ahead and take a sip. Ah, okay. There it is. That is how you do that game, that exercise. It's very easy. What you want to do is just put all your focus in what is it like to experience this sensation, right? So when you are taking a sip of your coffee or water or whatever food it is, try not to think about anything. Try not to get lost in thought. Try to focus exactly on what is happening right now, right? Put the focus in that sensation. It is a totally new way to experience life, and your brain will thank you for it.
That's fantastic, Dylan. Thank you so much.
Ooh.
All right.
Great illustration.
Yeah, it's terrific. All right. And Naomi gives a big thank you in all caps for that. So we appreciate it very much. Again, be sure to fill out the quick survey. Check out the resource page shared by both Susan and me. And Susan just put the link in the chat once more. And be sure to check out Fort Health and all the resources on their page, as well as our site, mentalhealthednys.org. Thanks again so much to Dylan and Shai. I'm going to put my email here in the chat. If anybody has any questions to follow up directly with me, you can always reach us here at the School Mental Health Resource Training Center at schools.mahaney's.org. And with that, we are going to end the webinar, and thanks again to everybody who's joined and presented today. All right. Have a good night,
Bye bye
everyone.
now.